Hello, welcome back to the Caring Conversation studio, live from the NEC in Birmingham. We have William here, I think probably our last interview of the day. So
I noticed the note of relief that you have in your voice.
Big shoes to fill, big shoes to fill.
Exactly.
Right, so do you want to tell us a bit about who you are and what you do, William?
Absolutely. So I'm William Balser. I'm the founder and managing director of Bridgehead Communications. We're a PR and public affairs consultancy that specialises in adult social care. I'm also a columnist for Caring Times. But as a PR and public affairs consultancy, we try to set ourselves out apart from our competitors by specialising in thought leadership. So we regularly interview policymakers and key opinion leaders within the sector. And you can tune into our monthly newsletter, Curate Insight, that we send out to the industry every month.
Perfect. So we were having a discussion before we started the interview about how much the care sector has changed since the 70s. So what are your thoughts?
Absolutely. So I saw, actually, it was on Lottie's website the other day. They had a fascinating graph that used data from the Office for National Statistics that showed how, since the 1970s, the nature of society has changed. And back in the 70s, the majority of people had children that were dependent on them, and how actually what we've seen is that as the birth rate has declined, you've seen that aging population go up, and in turn you've seen that commensurate rise in the number of people that have elderly dependents on them, and that, I think, is created quite a profound impact for the sector. You've seen a huge rise in the number of unpaid carers, and you've seen the care sector is kind of grappling to deal with this, this increase in demand, but it also presents huge fundamental questions for policymakers. How do you fund that? How do you fund this demand for care? How do you find the workforce that is able to supply the industry? And I think there's huge questions that policymakers don't quite have the answers to yet.
Yeah, there's been a massive sort of demographic switch, which everyone seems to be kind of overtly aware of, but we don't seem to be keeping up with the infrastructure, the services to actually provide the services that people are going to need, right?
Absolutely. I mean, one of the basic challenges is just educating this huge population of unpaid carers. A lot of them don't have very good awareness of the care sector, and so, for example, one of our clients, we work with Good Oaks, or a leading home care provider. They've launched their "You Are Not Alone" campaign, which was specifically aimed at providing education and information, free information and education to unpaid carers, to make them better aware of how to deal with some of the challenges that they face on a regular basis.
I'm sure I read something recently that said something like there's 1 million people who are economically inactive between the ages of 35 and 55 because they're unpaid carers.
Absolutely, exactly. It's a huge, there's a massive challenge. What do you do, if you're the government and you've got this massive segment of the workforce that's economically inactive because they're having to look after their loved ones. And so I think policymakers still don't have the answer to the question as to what they should do. And immigration is one of the huge questions that comes in that they have to wrestle with. You've got large chunks of the population who want to see immigration come down, but commensurate to that, there's also a shortage of people that are willing to work in the care sector. So, how do you square that circle?
Have you got any thoughts on then how the future of the workforce then kind of irons out from that perspective?
So, it's a good question. I think, there's no doubt that immigration is a huge part of the solution. Whether people like it or not, immigration has got to play a part. And you're seeing, you've got BA Healthcare, for example, they're one provider who specialise in providing skilled carers from the Philippines, bringing them into the UK. But also technology is another sector. So, you're seeing AI, and I think that has lots of potential for, and it's kind of, it's revolutionising, I think, almost every industry, including the PR industry, but also the care industry. But interestingly, I think robotics also has a part to play. We had, for our newsletter, we had quite an interesting interview with the professor from Sheffield University about the role that robotics can play in addressing some of the problems. So basically, his main point was robots are good at doing the jobs that humans don't do very well. So he says, realistically, you're less likely to see robots coming in to lift people up because there are huge health and safety implications. But certainly, in terms of AI and some of the other kind of more mundane functionality of robotics, I think has a huge part to play.
Well, I guess it's kind of reporting and tracking and things like that just inherently is boring for people.
Yeah, that's right.
Actually, if you can then just spend most of your time actually caring, and caring means connecting and
Absolutely.
engaging and talking to and doing things that they need help with.
Yeah, that's right. I think I think robotics and AI software solutions is definitely going to have a part to play, a huge part to play in the care sector and addressing some of that challenge, and also bringing down the cost of care. Caring for people is incredibly expensive, and I think that AI and robotics is going to play a fundamental part in bringing down those costs to make it more affordable, so that people are able to pay. I mean, we saw when Theresa May was Prime Minister, albeit briefly, we saw in the dementia tax, where the government introduced a policy measure whereby old people would have to sell their home in order to pay for their care. I mean, it's hugely unpopular, but it was one solution to the challenge, and the money's got to come from somewhere. It doesn't just grow on trees, and so how are we going to do that? I mean, personally, in my view, I think that it was probably quite fair that people, that rather than that money coming from somebody else, I think it's right that that should be one solution to paying and financing people's care.
Yeah, I think ultimately it's just a difficult conversation to have, because the narrative can be skewed quite strongly against you because it seems cruel and unfair. But I think ultimately
absolutely.
there is a question to say, right, well, if there is probably £20 billion worth of unpaid care given, and actually we need those people to be supported in some way, where's that coming
Absolutely,
from?
the money's got to come from somewhere. That's right, and it's really tough, and it's one of those difficult decisions that policymakers hate, because some of the solutions are deeply unpopular, not much of a vote winner.
No, exactly. That's it. So it then gets ignored and left, and
exactly, left to fester. I mean, a bit like some of the challenges with the NHS. You're seeing that people just, policymakers kicking the ball down the road, looking at these solutions, not wanting to implement the tough decisions that are, until eventually what happens is they can't kick it down the road any further, and some of the tough decisions that need to be made have to fall to, which, I don't know, Wes Streeting at the moment seems to be making.
Yeah. So in terms of then policy and regulation for the sector, do you have insights on kind of how that's working? Is given you're in some way connected to the sort of political environment, how does this new government gear up to kind of create new policies, things like how does that happen internally, like in the government,
in terms of the policy making
for the social care sector?
So it's there are multiple different sources where it can come from. So one is speaking to industry leaders themselves, speaking to trade associations, think tanks as well. A lot of.
Are there any big social care think tanks? Is that as a thing, or is that?
No, I think they tend to be. They tend to fall within. What will happen typically is a think tank will cover a broad range of different policy areas, including health and social care. But the King's Fund is probably the most notable one.
Yeah.
And they will have regular discussions with policymakers. They'll help to inform legislation and policy decisions, and they'll engage with ministers, their advisors. Behind the scenes, there are lots of these discussions going on a regular basis. One of the things that we do, with our clients to help inform that process is organising, for example, roundtable discussions with relevant policymakers, so that sector leaders can have their voice and have their say at some of the challenges. Absolutely.
I guess the report that you wrote for, was it Good Oaks?
Yeah, that's right. Yeah.
Something like that, where you're trying to influence a government.
Exactly. So the media is quite useful, is an important tool to achieve that. So what we did with Good Oaks was, in order to draw attention to their You Are Not Alone campaign, we did a poll. We organised a poll of 1,000 unpaid carers across the UK to look at the main challenges that they face, in terms of, have they given up work in order to do this? How much time does it take? And then we were able to showcase the findings in the Independent newspaper, as well as the major trade publications within the sector and the local press. I think we got 54 pieces of coverage, I think, off the back of that one report.
Nice.
So it's been good, but it's there's I think the thing that strikes me on a regular basis is the scale of the problem facing the sector, and nobody, policymakers or industry, I don't think people have properly worked out how to deal with some of these challenges that they're coming up. It's quite dementia, for example. Dementia's also a huge kind of growing challenge that it's very difficult for loved ones to help their relatives with dementia, and so helping to inform people about the effective ways to care for their loved ones.
You work in public relations, and I think I read your latest summary of the social care sector in the press, and mentioned what's the general kind of attitude in the press at the moment around about social care. Then so we're sort of getting an average amount of mentions, but is it positive, negative? What's the coverage like at the moment?
So it's a good question, and actually in one of our bits of analysis, we looked at the amount of media coverage that the sector is receiving over time, and it's perhaps unsurprisingly, what you've seen is that coverage was relatively static and at a kind of low level for quite a long time, and then as more discussion in the media takes place surrounding the aging population, that led to a bit of an uptick, and then COVID. It's just exploded. There was huge amount of attention paid on the sector because it was so profoundly impacted by COVID, and that heightened level of coverage has been sustained for quite a long time. And also, there's a lot of I think there's an ongoing discussion in the media about how the key policy challenges facing the sector are going to be addressed.
Nice. Any sort of final to finish? Any final top tips for people around any of those subject areas? Anything that people can do, I don't know, to drive more self-funding clients or anything like that you've got?
So, I think that actually what we've seen is as the level of coverage has increased, there's a greater challenge to have your voice heard and to have your opinions heard. So it's harder than ever to be an opinion leader. So one of the most effective ways is through thought leadership, so through coming up with insightful pieces of analysis, whether it be for surveys of unpaid carers or but coming up with regular solutions to some of the challenges that the sector's facing. I think that's one of the things that we specialise in working with our clients, and you can see some of the work on our website.
Perfect. Right. Well, thank you very much for coming to see us today, William.
Thanks very much.
We'll be back shortly, I think, just to close out the show.